Thank you, everyone, for inviting me. I'm deeply honored and happy to have the opportunity to talk to you. I am Director for Corporate Responsibility and Projects and Partnerships for Ericson. Ericson is present in 180 countries. We have, as was told before, the presence and the global coverage of 40% of that market. What Ericson is doing is not this one. This is our joint venture. We're very happy to use them, but what we're doing is doing the infrastructure for all this communication, all these educational needs that we have been hearing about before to actually become present and to actually be reaching out to the poorest of the poor, to the ruralist part, and to be able to make sure that we have the services needed and adopted for the use cases of anyone. Ericson believes from the beginning, when we were founded in 1876, that communication is one of the human rights of people. That's how you develop, that's how you learn. So, starting with that, I was very happy of the introductory speakers to mention the different advances that has been happening during the last years. We all know that mobile technology has been exploding in growth. And I would just like to point out that it has been exploding very much on its own merits. It's something that is needed. It's been exploding on a commercial basis. And for all of us who cares for a society, for developing and making sure that this service reaches out to everyone, that is very good news, because the service is there. It's for us to use it as good as possible. So it's up for our imagination. How do we use this? I also want us to acknowledge that the technology on its own is not the goal. It's the use of the technology. And for me, it's really fantastic to be able to work with this technology that can prove such advances. I would want to start by showing you a little about the scale. We're very concerned with scale. Being in 180 countries, we talk about scale all the time. Everyone who works with mobile connectivity is talking about scale. Today, there is 5.5 billion subscriptions in the world. There's no system that reaches that many people. There's an unprecedented possibility of reaching people, and for people to reaching you. What we see as well is that it's a little unevenly distributed, though. We see that Africa is lagging behind. We only have 53% of penetration in Africa. This is, of course, a challenge. It's been increasing and growing exponentially. But here is a challenge for everyone to make sure that the African communities also have the possibility to get affordable and accessible telecommunications. In relation, we can see 53% in Africa is really bad. But we should know that the fixed internet connections reaches around 2% in subscriptions. So this is the case today. What will happen next? From the projections from the branches organization, there's a lot of data collected in this area. And what we have seen internally is that we today have 5.5 billion. Already in 2016, we will have almost up to 9 billion subscriptions. This doesn't mean that everyone it's 9 billion people having one subscription. Roughly, it's 50% of that number of subscribers. And we have talked about that before as well. In a lot of countries, to be able to afford a handset might not be the case. Instead, you buy airtime. Someone has a handset. We have made a project right now, on Monday, we were launching our commitment for the World Refugee Day in conjunction with UNHCR. And we have made a lot of looking into and research on what about refugees. Those is a very marginalized user group. And even in the furthest and most remote refugee camps, one out of 12 has a mobile phone. The micro business of buying airtime of the person having the mobile phone or the SIM card is a business that is living, as we also have heard. It's also so that the mobile operators is developing a scheme called virtual mobile number. That means that you don't even need a SIM card. You can get a number. I think looking into this is also, again, challenging our imagination. What do we want to use this communication for, this opportunity? Just use your imagination. And we'll talk about some of the challenges and opportunities we can have. Before I do that, I want to challenge you even more. We have been talking about voice. We've been talking about text message. Everyone knows how to text. That's not difficult. But what if you had broadband to everyone? What could you do then? What if all devices, all things in the world were connected? All this data and research we're talking about, what if they actually delivered the information you needed all the time as a basis for decisions? We're talking about it very much in the developed world. How can we actually steer the usage of energy consumption in order to minimize the carbon footprint? That's one application of steering consumer behavior, steering via the devices talking to each other, informing, right now, you shouldn't use energy, it's too expensive. Use your imagination and think about which applications could be used in, for example, Africa. What about a water reservoir getting too low? If you get that information digitally via the mobile network, which is already there, how can you use that? How can you steer your decisions? So what we see is that the orange line here is actually the fixed lines, places where you had to have your cord. We actually were attached to the wall to call. Some of you may remember that. My kids don't. They don't understand what I'm talking about. 5 billion people talking to each other. But what we see is that we will have 50 billion connections. We already see that today. You can pay by SMS, tolls, tickets, everything can talk to each other. Everything that needs and benefits from talking to each other. We think that will happen. And this also makes the case for the dematerialization, the transformational possibility of this technology. Not the technology itself, but the usage of the technology. So we've been talking about mHealth and a number of great examples of how that is used with existing technology, the easy parts. It's not very widely spread yet. There are still pilots, it's scaling up. But what we can see is, of course, that everything that we are developing could actually change a lot of the behavior, not only by the people, by the individuals. I think it's more about, if we look specifically on the healthcare sector, how can you use the existing technology for preventive care, which we have seen examples of, the curative care, but also the productivity of the healthcare systems? This is equally valid for a developed country or a less developed country. How can you actually give healthcare to more people for the same cost? Or better healthcare with the same cost? How can you use these possibilities to do that? And this is where we, as being active in 180 countries and supporting most of the global operators in designing these systems, work on a global level. We don't look at one country at a time. We look at all the countries. And here is actually a great need for both branch organizations, for governments, for civil society to work on a global level to remove the barriers for having the true scale. And remember, for me, scale, that is 5 billion people. How do we do that? And how do we use all the advancements that is happening? And that might probably be a luxury for me. If I have a heart disease, for example, I might get a unit from my doctor so I can have remote monitoring. I don't have to travel to the doctor. But if we have that same things who are connected to each other, who collect the data from a village, what about a community health worker having those gadgets It all talks to each other. It sends it through to a more specialized organization. What would happen then? How can we decrease the cost of the individual? How can we increase the productivity of the healthcare system in that organization? But to do that, you need a lot of background networking, a lot of back-end systems and very technical things. And that is where we play the role, to support that, to also be possible to do cross borders, if needed. How do we do that? And you need a lot of different stakeholders to be advancing on these areas. And that's why we are working in something called the Digital Health Initiative, to bring up that as a thought leadership. How do we solve these issues together? I just wanted to show you some of these things that we have developed together with the Millennium Village project. We connected 12 different village clusters in sub-Saharan Africa with connectivity, and it's both voice, but it's also something called 2.5G and Edge, which is actually mobile internet. It's there. So this is quite easy. You take a picture, and it's used in different places already, and you can send images for peer-to-peer review, to educational purposes, etc. But also blood sample containing malaria. This is one of the applications we have developed based on our experience of the specific needs of the Millennium Villages. But what we see is as well, what happens if you had even more connectivity? If you had more broadband, if you can have more information, how can you then increase that? And which use cases should you start with? Where is it? Where should the technology be used, and how? And here is actually where I take it from the SMS, which everyone understands how to do, into a much more efficient, commercially based technology, which I really would like you all to start thinking about. It is there. One of the other areas which have been touched upon is the mobile wallet. And I know we have M-Pesa. I'm really looking forward to listening to that presentation. There is around 150 services of mobile money delivered today in the world. M-Pesa is one of the absolute most successful ones, which is a role model for most of the other ones. As we're not an operator, we're not directly talking to you as individuals. We're working about the backbone. Again, we lift it to another level of the dimension. What if you want to transfer money across borders to different countries, between different operators? How would that work? What about the global banking system? How do you take that to that level? How can we, as a provider with infrastructure, support that development to happen as quickly as possible? With the interest of the microfinancing, the microinsurance, also knowing there is a lot of people actually send remittances across borders. So this is our role coming into the mobile money and mobile wallet. And we definitely think this is something that each and every one of us will be using. And of course, we connect it to what we see, 50 billion. Okay, what things will be connected? What things will have automatic transactions between each other in relation to this? And again, think about then the national healthcare systems. How do we pay for that? How can you use a mobile wallet? In what stages can you do that efficiently? How can you use the different numbers of stakeholders and payers in a system? Because we strongly believe that to have a sustainable system, there has to have some kind of a value creation. You need to understand what is the value for the person who you develop the service for. And how do we measure that? And how is that really connected to what we do? The feedback loop is extremely important. And that's why we are pushing quite hard on the commercial value argumentation. I'll go into my very last slide. I could talk a lot about our different initiatives around the world, but I've been asked to talk about the global picture, and I hope I've done that. I would be really happy to talk about other things in the past, but when we work on this area, and having been in most of the countries in Africa for almost 100 years, we have quite a good knowledge about the challenges, the opportunities, the needs, and also how to work with partners. What we do always when we look into what is the needs of the poorest, how can we support the Millennium Development Goals? We have to see how is that done on a business scale. This is our core business. How can our core business support? From different angles of this one. We can employ people to work in the telecommunications area, and there is a number of studies that have shown that every increase, 10% increase in the mobile penetration, has a direct link to the country's GDP, which increases with 1%. That's not only because we support the microfinancing, it's also because the telecommunications industry actually employ a lot of people within the countries. So there is multiple effects of being investing and present in the countries. And I think here is an extremely important part for business to look into, and also government to see how can that be spurred better. That's why we always work with the core business. We always work with partnerships. We are a telecommunications company. We're not experts in health. We're not experts in education. We're not experts in agriculture. But others are. So how can we, with our core competency, team up with the guys who knows this is the need, this is who you should talk to, this is how you shouldn't do it. Of course, we gained a lot of experience since we have been very active and run a number of pilots and big projects in the area, but there are people who know the exact thing. We need them. We need to partner with them. And we need to partner with the providers of the services, such as Safaricom, such as Telenor, such as Zain, etc., which we always do these public-private partnerships. And last but not least, we have to find a sustainable business model. As we do this, out of our belief that the service is needed, we're providing something that somebody needs. How will that be sustainable? We can't have it a short-term grant funded. It has to be an inbuilt system of funding of the system. How do we find that? And here we have to be extremely creative and innovative. Here is the innovative part. What is the innovative, sustainable business model? How do you combine different flows of income into this? And lastly then, the blueprint for scalability. We work on a scale which is 5 billion people. And that's our strength on understanding how to take pilots and design pilots to work for that scale as efficiently as possible. Thank you very much for letting me come and talk to you. We're happy to talk to you afterwards.